name is Ashley. I'll be the physician assistant student taking care of you today. You're Ms. Patel, is that correct?
Yes.
Okay, do you have a preferred name you want to be called today?
Nikita's fine.
Okay, Nikita, it's very nice to meet you. Today we're be doing a general survey, vitals, HEENT exam today. While I go wash my hands, can you please take your shirt, shoes, and socks off?
Yes.
Thank you. Using hand sanitizer because we don't have a sink near us. So for the general survey exam, I am going to assess the patient's presenting appearance and general health status. If her stated age correlates with her apparent age, her body, her grooming and hygiene, noting any breath or body odor, her body habitus and any obvious physical deformities, her posture and motor activity, her facial expressions for any signs of distress, and lastly, I would perform a mental status exam at this time to assess her level of consciousness. Next, I would move on to the vitals. I would take her height and weight. I'm now just going to move on to the measure her oral temperature. So I already have the little plastic probe on top. I'm going to turn it on. I'm going to have it open, close. Do you mind holding that for me, please? While she's working on that, I am going to take her heart rate. So I'm going to palpate her radial pulse with the index pads with my index and middle fingers. I'm going to count the number of pulses in 15 seconds and multiply by 4. And when I'm doing this, I'm going to assess the rate, rhythm, and amplitude of her pulses. In the same position, I am going to observe her chest. I'm going to assess the rate, rhythm, and depth of respirations in 15 seconds and multiply by 4. Okay, so for pulse, I got 65, and then for her respiration rate, I got 16. We're still waiting on the temperature, so I'm just going to move on to the blood pressure. I'm going to make sure that the cuff is the appropriate size for the patient. So just going to make sure that the bladder width is approximately 40% of her arm circumference, and the length is about 80%, which it is. So I'm going to palpate the brachial artery right now. Now that I've found it, I'm going to secure the cuff so it's 2.5 centimeters above the antecubital fossa. So, here. Next, I'm going to determine her palpable systolic blood pressure. Before I do that, it just beat, and it was 98.2. So what I'm going to do is I'm going to take her radial pulse. I'm going to turn it down. I'm going to pump it until I can no longer feel it. Okay, put it down. So what I'm going to do now while we're resting is that I am going to inflate the cuff so that it is 30 millimeters of mercury above her palpable systolic blood pressure, which was 110. So I'm going to pump to 140. I'm going to listen for the onset of carotid cough sounds to determine her systolic blood pressure, deflate the cuff 2 to 3 millimeters per second, and then listen for the cessation of carotid cough sounds to determine her diastolic blood pressure. And relax right here. So I got 114 over 70 on this side. I'm going to now measure the blood pressure on the other side. If necessary, I would, after recording both blood pressure readings, I would do more additional readings in the supine and standing positions. So let's just put this on. Okay. Listen. And rest your arm right on top of me. Yep, keep it relaxed. Okay, so on this side, I got 114 over 74. I'm gonna put this down for a minute, and then we're gonna start the skin exam. For that, can I please have you stand up? So right now, I'm gonna inspect the skin for pigmentation, looking for any signs of discoloration. Also, I'm looking for rashes, masses, lesions. Yep, can you please, yep, okay, can you please turn around? Thank you, I'm gonna spread the back. Do you mind just like lowering so I can see like your lower back? Okay, thank you. And then raising your shorts. And then you can lift each foot so I can see the bottom of your feet. Thank you. Other side. Okay, you can turn around again. Now I'm going to palpate for temperature, texture, moisture, mobility, and turgor. Temperature, moisture, texture, mobility, and turgor. Temperature, moisture, texture, mobility, and turgor. Temperature, moisture, texture, mobility, and turgor. And lastly, I'm going to inspect her fingernails and toenails for cyanosis, burnosis, lesions, lines, and clubbing. She has nail polish on, but I can still see the nail beds at least. And then there. Moving on to the head exam, I'm inspecting the head for position, size, shape, contour, and deformity. I'm going to inspect the scalp. Can I please have you tuck your hair down? Sorry, I just have to part it. For hair texture, hair growth, lesions, lice, nits, and dandruff. Okay, on this side. Okay. And now I'm going to palpate the head, the skull, for contour, deformities, masses, and tenderness. And then I'm going to do palpate the scalp for mobility and tenderness, the temporal arteries for pulsations and tenderness. I'm going to palpate the temporal mandibular joint for tenderness, crepiness, and deformities. Can you please open, close, left and right? Thank you. I'm going to palpate the parotid glands for edema and tenderness. No. Okay. And lastly, I'm going to palpate the forehead for any tenderness, supraorbital ridge, any tenderness. No. Zygoma for tenderness, and the mandible for tenderness. Okay. Moving on to the eye exam, I'm first going to inspect the eyelids, eyebrows, and eyelashes for any asymmetry, erythema, and lesions. I'm going to inspect the eyelids for position and closure. I'm going to inspect the area over the lacrimal apparatus for any edema and lesions. I'm going to palpate the area over the lacrimal apparatus for any tenderness, and I'm trying to express any discharge from the nasal lacrimal duct. Okay. Next, I'm going to inspect the bulbar and palpable conjunctiva. So I'm going to actually pull down your eyelids when you look up. Okay. Now I'm going to look down. I'm looking for any lesions or injection. I'm inspecting the sclera right now for the color and noting any injection or blood. Moving on, I think we've done all the inspection parts. So I'm going to do the visual acuity test. I have my Rosenbaum chart, so I'm going to position it so that is 14 inches away from the patient. You can hold on to this if you don't mind. I want you to cover your right eye with your right hand and read the lowest line that you can.
374258.
Okay, and now the other.
374258.
Okay, and now with both eyes.
937826.
Perfect. So I would do this with and without corrective lenses. While I still have the chart with me, I'm going to measure the pupil size and inspect for symmetry. So for her, 6 millimeters on her right, 6 millimeters on her left. Moving on, I'm going to perform the visual fields by gross confrontation test. So what I'm going to do is I'm going to have you look directly at my nose. I'm going to have your hands right here. So I'm going to be waving my hands around your head, and once you see my fingers, I want you to point up, okay?
Okay.
Ready? Okay. I'm going to grab my pen right now as like an object to look at to do the extraocular muscle test.
Mm-hmm.
So I'm going to stand an arm's length away from the patient, or you can just put your arm out. Perfect. So I have my pen light right here. I want you to keep your eye on the top as I move it in different directions. And when I'm doing this, I am testing for nystagmus at the extremes. Okay, now I'm going to have you look at the picture behind me. So I'm going to test for accommodation. So as she's looking there, I'm going to ask her to now look at the pen light. Okay? And now that I'm like about an arm's length away, I want you to keep your eyes focused on the pen light as I move it towards you to test for convergence. Okay? And then I want you to keep your eyes on the pen light again as I move it down, because I'm testing for lid lag, making sure that the eyelids close symmetrically. Now I'm going to move on and use tangential lighting to inspect the cornea and assess the anterior chamber, noting any crescent shadows in the medial aspect. Okay, and last test for at least this part. I'm going to put my hand on the bridge of your nose. I'm going to cover it so that you can't, the light can't go over there. I'm going to test for direct and consensual pupillary reaction. So I'm just going to shine the light in her eye and look at the pupil, and it constricts. Then look at the other eye for consensual. Now I'm going to do it with this eye. Constrict. Now look at the other eye. Okay, so now I'm going to get my ophthalmoscope ready. I'm going to turn it on, make sure the diopter is the appropriate size, and I'm going to dim the lights. I'm going to stand 4 feet away from the patient to assess the corneal light reflex for symmetry. Once I find that they're both symmetrical, I'm going to advance so I'm 15 inches away from the patient, have my hand on the diopter. I'm going to assess for the red light reflex, so just looking for the red, and once I find it, I'm going to advance further and look into the optic disc and inspect the optic disc, the margin, the cup to disc ratio, the retinal arteries, veins, and the condition of the retina. I'm now going to have her look into the scope so I can visualize the fovea and the macula. Okay. All right, I'm going to do it with on the opposite side. So at 15 inches, red light reflex, advance, observe the optic disc, arteries, veins, and then look into the light. Okay, for fovea and macula. Okay, now I'm going to turn that off and I'm going to bring the lights back on. We're going to move on to the ear exam. I'm going to inspect her auricles for deformities, discharge, and lesions. She has lovely earrings on. And then I'm going to palpate the auricle, tragus, and mastoid. Any tendon? Okay, right here. Now that I did that, I'm going to perform the whisper test. So I'm going to stand 1 foot away, 1 to 2 feet away, whisper a 2-syllable word. Football, okay. Cupcake, perfect. Now I'm going to get my otoscope ready so I can inspect the inside of her ear. So I am going to just step aside here, put the appropriate size speculum on. When I'm looking in, I should be inspecting the external canal for the amount of cerumen, inflammation, edema, foreign bodies. I'm going to use a fulcrum, so it's going to be my pinky, and I'm going to position it so you can actually sit down for better comfort. I'm going to hold exactly like this, insert in. I'm also going to examine the tympanic membrane for the color and contour. It's a pearly gray. I can also see the malleus, umbo, and the cone of light. I'm going to repeat this on the opposite side. So position my hand, insert right here. Okay, alrighty. Okay, now I'm going to turn that off. I'm going to get ready to get my little tongue depressor and my pen light out for actually I'm going to do the nose exam. Forgot about the nose exam. So first I'm going to inspect the nose for any deformities. I'm going to palpate for tenderness. Any?
Nope.
Okay, I'm gonna test for nasal patency, so I'm gonna have you occlude one nostril and then breathe in. And then breathe out. Other side. Okay. While I'm here, I'm actually just gonna palpate frontal and maxillary sinuses before I go get my scope. So I'm just gonna use my pads of my thumbs. Any tenderness?
No.
Okay.
No tenderness.
Okay. Let me. And I'm gonna change the speculum so it's a bigger one, a little bit more comfortable. I'm gonna use the fulcrum similar to the ear. I'm going to inspect the nasal mucosa, the turbinates for polyps, and then also the septum for any deviation or perforation. Can I have you please look up? Thank you. Oh, lovely. Okay. Now I'm gonna do the other side. Okay, lovely. Alrighty, I'm gonna move on to the mouth exam. So I have my tongue depressor and my light. I'm basically just gonna shine my light in here and look around at the buccal mucosa. I'm gonna look at the tongue. I'm gonna look at the floor of the mouth, the roof, the teeth, the gingiva. I'm gonna actually have you take a deep, open your mouth and say ah, ah. So I'm just looking at the posterior pharynx right now, just looking at the condition of the tonsils. Can you please stick your tongue and go ah, ah. Perfect. I'm just looking for the symmetrical rise of the uvula and the palate and the phonation. And now I'm going to inspect the tongue. So can you do it again? Thank you. I'm just looking for any, the color, the texture, any lesions of any sort. I'm gonna go put my gloves on right now so I can palpate the tongue. So, gloves are a little bit of a hassle. I have my gauze here. I'm just gonna palpate the tongue, just holding it there and then just palpating all sides for any induration or masses, anything. Switch sides. Okay, perfect. Moving on to the neck exam, I'm going to inspect the neck for any asymmetry, masses, thyromegaly, jugular vein distension. I'm just going to have her swallow, just make sure that the trachea is midline. I'm inspecting over the thyroid gland for any edema or masses. Next, I'm going to palpate the thyroid gland. So I'm going to actually go behind you. It might feel a little bit uncomfortable.
Okay.
Okay? Mm-hmm. So I'm going to use my pinkies to surface it on the clavicle, and then I'm going to use my second through fourth fingers to identify the thyroid gland because it should be around there. I'm going to displace the trachea to one side, and then basically I'm going to palpate the right thyroid lobe, and I'm going to do the opposite for the left right now, and then I'm going to palpate the isthmus right in the middle. Okay. All right. Lastly, I am going to do a lymph node exam on you today. So I'm going to start with the preauricular lymph nodes right here, the postauricular lymph nodes right here, the occipital ones in the back of the skull. I'm going to do the tonsillar lymph nodes right here, the submandibular lymph nodes right here, the submental ones right here, the anterior cervical chain, the posterior cervical chain, and then I'm going to have you actually turn your head to one side so I can feel in the deep cervical ones right in here. And then the other side. Perfect. And then lastly, I want you to take a deep breath, and I'm going to palpate your supraclavicular. Yeah. Okay. And that is all for today's exam. I want to thank you again for being the patient for my video.
Sure, no problem.
Okay, cool.